Health insurance has become an integral part of life for many of us, right? But sometimes your coverage can be denied out of the blue.
Yeah, and if you're continuing to have issues with your insurance, it's best to know all about the tools that you have at your disposal. So listen to this one. 90s medical expert Dr. Payal Kohli is going to join us to take a deeper look right now. Dr. Kohli, thank you so much for joining us.
Good morning.
We appreciate it. Okay, this is something we get asked about a lot. So a lot of people aren't even familiar with what the standard terminology is.
Yeah.
Let's go over that vocabulary if you don't mind. So let's talk about copays, coinsurance, deductibles. What do they mean and what's the difference between all of them?
Yeah, so copay is a fee you have to pay at the time of service. This is non-negotiable. So this is not something you can fight with your insurance company about. Usually about $20, sometimes $50 if you're seeing a specialist or not, but it's at the time of service. Then once you pay your copay, you have something called a deductible. So let's say your deductible is $1,500. That's the amount you have to pay before the insurance sort of quote unquote kicks in. So this is where people get tripped up because they say, oh, well, my service was covered, but I still got a big bill for $1,400. Well, that's because you hadn't met your deductible yet. So something can be covered and then be applied towards your deductible, which means it's still your financial responsibility. And then once you hit your deductible, then you may have a co-insurance. So let's say you have an operation, $5,000. $1,500 is your copay. That $3,500 then gets split between the insurance company and your coinsurance. So you could have a 20% coinsurance. So part of that $700 is yours, the rest is paid by them. So it's very confusing and very tricky, which is why you need to know the terms when you're picking your plan, depending on how you utilize healthcare.
Yeah, totally. Okay, good to know about the non-negotiables right now. How do we know what we owe for medical care?
Yes, so if you walk into Starbucks and order a cup of coffee, you know exactly what you owe, right? But if you go to a doctor's office and you get an EKG and you have a visit and then you get some kind of blood drawn and an injection, you may not know what you owe. So the way to find out, there's two methods. One, which is called the before method. This is what I recommend to people. If you're about to have an expensive imaging procedure, expensive surgery, or expensive test, call the number on the back of your insurance card, give them the code for what you're going to have. And don't say, am I covered? Say, what is my out of pocket?
Yes.
You know, because then that takes care of those deductibles, coinsurance, copay.
And if you say, what is my out of pocket, and they have an answer, that means you're covered. So you kill two birds with one stone.
Exactly right. And they'll tell you whether or not it's covered at full amount or partial amount and what have you. And then you know ahead of time exactly what you're going to have to pay. The second method, which is what most people do, which I don't recommend, is waiting for something called a paper explanation of benefits. This is a little paper that comes in the mail, looks like a bill, but it's not a bill. It tells you how much insurance covered, how much you covered, and then how much the doctor's office is going to charge you.
So is there anything that you can do to avoid any problems, maybe avoid getting denied or avoid just getting that really big bill?
Yes, lots of things. So first and most important, and my patients make this mistake all the time, you have to check if your provider and your facilities in network. So just because somebody takes Anthem or somebody takes Cigna or somebody takes, you know, some other insurance, it doesn't mean that you're going to be covered as an in-network. You could be out of network. So that's usually your job. Again, call the number on the back of your insurance card. Say, I'm seeing Dr. Kohli. Is she in network with my plan? Because every insurance company has many plans. Because once you get a bill out of network, there's nothing you can do. There's no options for appeal or anything like that. The second is it's something called prior authorization. You may have never heard of this because this happens behind the scenes. But if you're getting anything expensive, anything besides an office visit, an MRI, a surgery, any kind of procedure, the doctor's office has to submit for permission from the insurance company. If they don't submit for permission, even if that was a covered benefit, you could get denied if they don't get that prior authorization.
Okay, that's really interesting. What types of procedures are we talking about here that you have to get that authorization for?
So I would say anything that's expensive. So if it's just an office visit, you don't need a prior authorization. I do EKGs in my office. Those are easy. You don't need one. But if it's something like an imaging test, a biopsy, you know, any kind of cystoscopy, any kind of uterus procedure, GYN procedure, even sometimes the GYN will do an ultrasound, a quick ultrasound in the office, that might need a prior authorization. So it's always a good idea to ask your doctor or your provider, your pharmacist, does this need a prior authorization to help get yourself covered?
And then if you do get denied, what can you do to fight back?
So I think the first and most important thing is to figure out if you have a fight, because you don't want to waste time fighting about something you're going to lose. If the doctor's out of network, There's nothing you can do to
Right.
fight back. That's why I say do your homework ahead of time. Instead, you could go to the doctor's office and say, could you please apply a self-pay discount or friends and family discount or something like that. But if you have a fight and you've done that prior authorization ahead of time, you can appeal it and you can have your doctor write an appeal letter. In fact, AI does a great job nowadays of helping doctors' offices write really strong appeal letters, citing the guidelines, citing the medicines you failed, citing why this is important. And a lot of my appeals have been overturned, I've been happy to say. So
I've used it too, and
Right?
it's worked great, yes.
So fight back if you can, but in order to fight back, you need to make sure you had all your ducks lined up in a row and you did all your homework going into the procedure.
Yeah, gotta do a lot of stuff on the front end, right?
Yep,
Not
yep.
just cross your fingers on the back end. Dr. Kohli, thank you so much for breaking that all down. And of course, you can find all of Dr. Kohli's appearances on 9news.com/Dr. Kohli.